All right, we are at the top of the hour and it looks like most folks have had a chance to join the webinar. So I wanted to welcome everyone to Improving Member Onboarding. It's never too early to think about member retention. I have just a couple of quick housekeeping items before we get started today. To let everyone know that during the webinar, you can use the Q&A buttons at the bottom of the Zoom window, and you can submit to us any questions or comments or things of that nature that you have. We'll try to answer them in the moment, but if we're not able to, we'll certainly take questions and answers at the end and can follow up individually with folks as well. Also, to let you know, the webinar is being recorded and the playback video, as well as the slide deck, is going to be made available to all attendees. So without further ado, I want to introduce our moderator, Enam Noor. He is the CEO and founder of Insight and Health, and he brings to us a wealth of experience and knowledge. He spent the last 20 years in marketing analytics and consumer engagement, and then this last decade here in the healthcare member engagement optimization space. Prior to that, he was the founder of a cloud-based strategic marketing consultancy that utilizes big data and machine learning to provide business intelligence. So I won't delay us any further, and I'll go ahead and turn it over to Enam, who will be moderating our discussion today. Thanks for joining us.
Carissa, thank you very much for the introduction. Everybody, welcome to our webinar. This will be a fun, good interactive discussion, and good afternoon to all of you. We have a very strong panel that are super experts, way more smarter than I ever could be, to talk about the topic we have today. Very interesting topic, right? If you think about any industry, especially in retail, people think about the companies think about retention way before they think about even onboarding, right? Amazon Prime, you name it, or we all fly or stay in a hotel, the loyalty program. So retention is very important, but we find it sometimes challenging when we look at it in the healthcare member experience, and it almost becomes an afterthought because everybody spends so much time on acquisition and then onboarding, and then all the activities required, docs, whatnot, you name it, right? So we're going to hear from the panelists today, which I'm going to be asking them very shortly to introduce themselves and their expertise around this topic, how they will be able to carry on some conversation, and more importantly, the questions that the audience that you have today, how to cater to those. So today we're going to have Justin Skerbetz, James Lewis, and Michael Wood as part of our panelists. And I'll ask in that order, if all three of you kindly introduce yourself, and then we can kickstart our conversation.
Hey, thanks, Enam. I'll start there. Justin Skerbetz. I'm our Chief Marketing Communication Officer for Parkland Community Health Plan. My background has always been in marketing and for government programs. I actually spent the first 15 years of my career in a Medicare Advantage plan in Pittsburgh, Pennsylvania, in which we saw tremendous changes in the industry, and I kind of got to navigate that as I grew my career. The past 2 years, I actually found an opportunity to move to Dallas and oversee the marketing and communications area for the community health plan of Parkland, which is a county hospital plan. And it's been a fantastic journey in which we get to really focus on the impact we make to the community. Yes, membership, revenue, those things are still important, but how we actually better the area we live in and the community we serve is how we're measured. So thank you, Enam.
Good afternoon. My name is James Lewis. I am the owner and president of Paragon 7 Studios and Consulting Group. We specialize in two things. One is healthcare media. So I work with a lot of clients about their media profile and using television and radio to advance their product line or to reach end users, members, whoever their constituents are. And then I also do a lot of consulting for risk adjustment, stars, and increasingly more in the CAPS business. Prior to that, I have close to 15 years of various levels of executive experience running risk adjustment, stars, value-based programs, and clinical quality programs. So it's been a great ride. And then I also have a weekday every day from 12 to 1. I'm on the radio. I have a platform that we combine current events and politics. We talk a lot about healthcare, and we do a really good job of getting to consumers. We have programs where we have nurses and people call in. We have great leaders like Enum that come on and support, and really the goal is to normalize conversations about medication adherence, and conversations about making sure that you're getting your diabetes care managed, and in-home assessments. So that's what I do. I enjoy it, and it's always been a pleasure working with the Insight team. There's some great people there.
Thanks, James. Thanks, Justin. Thanks, Enum. I'm Michael Wood. I'm the Chief Strategy Officer here at Insight and Health. I came from a health plan background. In fact, both Justin and Enum, we were in a similar spot at some time, and Enum was actually my vendor when I worked at the health plan. My background is STARS quality, and mainly with a kind of focus on experience and member experience in particular. Prior to that, I worked at Accenture as part of their human change consulting arm. And prior to that, I actually worked for many years in the UK in public sector, basically working on transforming their public services from let's say an archaic kind of state to a more kind of digitally focused state. So a lot of the challenges actually that exist in healthcare here actually were challenges that we faced before back in the UK. So there's a lot of similarities there in terms of engaging large populations and being able to measure and understand that experience across a complex geography.
Well, thank you, Justin, James, and Michael. Wow, what a great background you all have. That ties in with our topic today. Really exciting. Justin coming from the marketing communications, that's the heart and soul when you're trying to have conversation with your members. James, throughout your career, all the executives, all the conversation, all the problem that you hear from all the talk shows that you host, and then Michael, coming from both technology solutionist, consultant, and also working for the government, really seeing at all angles how to interact with the consumers, right? That's the center of today's conversation. So I'm going to go straight to the point. I'm going to put Justin, you right on the spot. Why is onboarding important? Just walk us through, from your journeys, why is onboarding so important?
Yeah, I mean, onboarding to me kind of boils down to two things that you're really trying to create from the health plan side, and that's setting expectations. Every health plan is a little bit different, right? We all have various goods, various bads that we are trying to overcome or enhance or highlight. And by setting expectations, you can really ensure that every member starts the journey with that health plan on the same page. And that sometimes is bringing to the forefront exactly what might be an issue that you have with the health plan or highlight. And then secondly, the biggest thing for me is you are really creating loyalty with your plan in the onboarding from the get-go. So many of the things we get tasked with are rapid disenrollment and other type of situations that creating that loyalty with the health plan is really where onboarding can create that highlight.
No, that's a key, right? Loyalty is important when you think about retention and the end goal. James, I'm going to pick your brain a little bit here. So, as working in different departments within the health plan, everybody communicates with the member, right? There's no stoppage. If you ever ask a health plan, how many times you touch your members, it's I don't know, too many. So working not in the marketing department, right? You are more into risk adjustment and all of those other parts of it, but there's a lot of communication goes out, right? Soon as somebody has done onboarding, right? How do you how do you collaborate, and what is the best practices you hear from your conversations out there, that there could be a coordinated conversation building, right, with the members, to that loyalty aspect of it? How do you, or what are the challenges you face? Walk us through a little bit there, because that's the journey to begin with, is retention, right? So,
Well, I think that the first and foremost, it's very important that you have open meetings and communications that cross different verticals. So, sometimes in matrix environments, you have situations that the objective is to share information, but you still have silos of information. When I was in the blue system, I always had my meetings open to the general public. So because these type of programs, stars risk adjustment, are so important to the lifeblood of the company. So I wanted people from marketing to come. I wanted the clinicians to come. I wanted people from agreements and appeals, even departments that weren't under my vertical, to come so we could share ideas and have that discussion. When you have individuals that share information and you have open meetings and you talk about communications going out to members, someone might say that, hey, we're running the same campaign. Can we collaborate? Can we work together? But if you don't share that information, like you said, Enam, you might hit a member with a barrage of calls or letters that can actually have an adverse effect. So the first thing is open-ended communication. I think the second is, I've always been very high on written policy and procedures. Policies and procedures are really important, and there should be P&Ps that are developed around marketing campaigns, so that you can't unilaterally, me as the risk adjustment and stars guy, embark on a campaign without having that discussion with other executive levels to understand what the total and panoramic view of the member is. So I would say the P&Ps and just general courtesy and sharing information are two valuable resources I've used.
That's a great insight. Justin, real quick, let me put you on the spot. James mentioned that open communication is the key, right? And obviously, being in the center of marketing, you probably keep getting all those intakes, right? Everybody wants to communicate with the members, and some say, hey, I don't really care. Let's get this campaign done. It's a robocall, which I always make fun of robocalls, but it works, right? But then, like, how do you coordinate? How do you coordinate these things? Like, do you utilize technology? Like, how do you do it? It's not simple, right? You only got so many months, because it's unlike any other industry. Like, there's open enrollment every year. So, like, what do you do? How do you coordinate those open communications?
Yeah, I mean, from kind of the marketing and communication standpoint, we do it in two folds. So we actually created a behavioral framework for all of our communications that go out, whether it's something that we develop ourselves, somebody from our clinical quality area needs something, our vendor partners. The amount of outreaches that occur in health plans is something that's been talked about for many years, and it really hasn't decreased, right? So you got to kind of attack it in a different way. And so by creating this framework and accepting that multiple areas are going to be outreaching and have various goals that they're trying to accomplish, this allows us to take every communication and look at it from a manner of how we're activating our audience, how we're addressing their barriers, and how we're helping them move from intentions to actions. These are kind of proven behavioral science approaches that help successfully change behavior and initiatives. And then when you have that, I feel like most of the organizations that we work with start to really understand the greater picture of what we're accomplishing together as one. And then managing through that, we actually have it all centralized through a touch point communication channel. And that allows us to, at any given point, to see each member and what they're getting across the various departments that are outreaching. So it's a centralized technology technique, but then it's also using that strategic framework. So it's looks, feels all the same.
No, great aspect, because behavioral, change is a big part of it, right? Because why do we want to stay healthy? Why do we want why do we keep looking at the cheapest health plan possible? That doesn't make me healthy, right? Like, these are the things consumers go through. Like, any other industry figured it out. We have to get to the consumer's head, right? And how do you do that? Obviously, understanding the behavior is the key, because what could work for somebody might not work for someone else. So talking about consumers, Michael, you have seen it all, not just in US and overseas. You've dealt with people, human change, very fancy word, but so you worked at the health plan, that, when people are doing, hey, we got to improve it, especially in the Medicare Advantage, segment, right? Stars, we got to improve stars. We got to go, he does gaps in care, all these things. Hey, how many gaps we close? Like, sounds very rigid to me, right? Like, you really want people to engage with you. You're just going to tell them to do something and say, I'll give you a $25 gift card, right? But experience is the big key, right? How we deliver the message, all the communications that's going to come up, right? We try to get smarter, try to read out all the fancy numbers comes out of Forrester, Gartner. So there's the numbers I was looking at in Forrester that, how, 80% plus of the consumers ask that, they want to feel like they're heard, the experience that there's an open understanding. And when that happens, the numbers are eye-opening. Like 73% would say they'll stay with the health plan. 82% say, look, we'll be your advocate. Now think about it. Those are numbers that click goes loyalty, right? I heard loyalty earlier, retention. So when you come from that aspect, all those activity needs to be done, right? He does gaps in care, CAPS House, you name it, providers are involved. How do you start leveraging, putting the experience in the bottom of it when these communications start going out? You want to touch base a little bit, walk us through from your experience?
Yeah, great question. I think that there's a couple of things I think that are important to understand. First of all, you're right. There's a whole host of communications that are kind of driven around, the normal cycle of insurance and signing up, etc. I think one of the simplest things to do is really understand all the, and James and Justin spoke to this too. It's really understanding how at the very first point, how are we communicating with that member to set those expectations? And if that expectation is that I open my mailbox and it's full of mail and it's all different, that's not a very good start. So I think just first of all, understanding, how best to communicate with your membership. But secondly, I think it's really down to how can you prioritize the most important information for that member to help them either start their journey or continue their journey. A lot of the time, there is a lot of information that needs to be both given and kind of, received from the member side. So being able to break that down into more bite-sized chunks, I think helps people not feel overwhelmed. And obviously, if you're setting those expectations at the beginning and you're being true to that, and you're also showing that across your organization, kind of latitudinally, that you're also communicating with each other so that the left hand and the right hand knows what they're doing. I think all that helps build that trust. And as you were saying, the figures you were quoting from Forrester, I think they're, it just shows that if you approach that the right way and you actually, you're able to really meet the member where they are, then, you're going to be successful. And that will, just by design itself, will lead to more people wanting to stay. Obviously, then you've got to put products and services into the market to keep them and to attract new people. So it's very circular with a never-ending kind of workflow to it, I think.
No, there's a great word you just used there, Michael, is trust, right? If you don't trust a brand or a name, you're never going to get engaged too much, right? And we know, again, study shows the trust factor for health plan logos are not very high in general with the consumers. So how do you prioritize? I'm going to ask this question to you, James. You talk with many folks and every day, and you probably hear this kind of problem. when you're trying to build a trusted engagement conversation, all focused around the members, the journey being in the middle, how do you prioritize what comes first, what's next? Like onboarding happened, is it retention has to be thought through like later, like because there's some required activity? Like what's the best practices maybe for the audience, if you kind of like guide us through some of the problems you hear and some of your recommendation how to like prioritize those activities?
Well, it's not easy, because a lot of health plans are in a situation where they are beholden to what's going on in the P&L. So if you're in the mid-star area, you're between 3 and 4, you don't have that additional reimbursement to invest in your plan and maybe have better concierge service, better customer service, all of those things. So it becomes a financial boondoggle. My advice is always to start with the member. And I think we've had a lot of success on my radio show. We take calls from members about their experiences, about mental health, about diabetes care. We have a nurse line and people just come in and talk. I think that leaders that do bids, that do the actuarial side, that actually put together the product development, it always has to be member centric and the member has to come first. The member, they don't care about the star rating. They don't care about RAPS EDPS. They don't understand any of those type of things. But what they do, the things that do resonate with them is when they have a warm touch. If you have a vendor that makes a call and it's fantastic customer service, if you have an application that makes it easier for them to schedule an appointment, if they have fantastic touch points, those will be reflected through the provider chain and through utilization. And then you're able to talk to members specifically about chronic care management and improvement and whatever clinical rubrics that you have. But I just think a lot of health plans are so focused on the bid cycle and the revenue side. And really, you truly have to strip yourself of that, even though, we have to remain profitable to stay in business. But when you're planning your benefit package, you have to almost take the view of that member that's 82 years old and maybe has limited travel capacity. And you have to look at it from their eyes, and everything radiates out from that.
Great advice there. So the key here is to putting the members and their needs first,
right,
but craft activities around the financial return as well, because at the end of the day, it's, whether we like it or don't like it, if the P&L is not speaking, it's becomes challenging everywhere. And not to mention, look, we all know if you're, focusing a segment like a Medicare Advantage, obviously stars rating all has, benefits, right? Even the CMS would want you to do more of those kind of activity, improve the satisfaction caps on house. So these all make sense, right? And then when you're thinking about,
when you're putting your vendor portfolio together, it's so important to vet those vendors and the experiences that customers are having with the vendors. Because, someone like myself who's been a quality VP, I'm never going to talk to a member. So if you're bringing in great vendors like Insight and Health and people that can represent you as a liaison to your members, you're putting yourself in a position to succeed. Sometimes you outsource things and bring vendors in that don't have the same they don't have the same makeup that you have. They don't have the same objectives. And you need to be aligned there, because these are the people that are going to touch your members.
No, it's a great point that, a lot of time vendor selection process becomes, well, who's the most cost effective, who's has generated some results, returns. I always say, like, spending a lot of time in the retail consumer experience, that it's easy to sell, but it's not easy to sell with a good experience. And when you do that, you create that memorable moment that then creates the loyalty that then gets into the retention. You shouldn't have to even think about it, right? But we're thinking about it in healthcare, right? We're trying to create all of those activities and everything. And I think, Justin, again, I'm going to bring you to this mix in the conversation now. So great. We want to build trust. We want to build loyalty. We want to prioritize everything around the members. But, if the money doesn't talk, it doesn't work for anybody. It doesn't lower the cost for the consumers. Do you have some examples, some kind of a use case that you can walk us through that, hey, when things are done right, here's the kind of results you might be getting. Here's the kind of retention numbers that impacts the overall P&L, if I want to use the exact word as James mentioned. But again, I get it. You come from risk adjustment, so those are in the focus point. So Justin, walk us through. Give us some example. Let's see if the audience can relate to it, how it can actually financially or ROI, KPI, everything could be there.
Yeah, I mean, so our health plan has been going through a transformation for the past 3 years in which we've begun insourcing all activities. For 20 plus years, the health plan had used a third party to administer every aspect. And there was a small group that managed that oversight. And so we basically got to create from scratch. And part of building from scratch does require spending some money to build those capabilities. And so the question that we knew we would need to answer is, what is that return you're going to get? So James hit it right on the nail on the head when he talked about understanding your customer. That was the first thing we did, is really dove into what they were thinking, what they were feeling, what they were doing, and have a greater understanding then of what misperceptions might be out there. The health plan thinks one thing, but the customer doesn't always think that same way. So we really sought out to change the way they were thinking, our customers, that is, around our network, around our benefits. And through highlighting that information, we were able to really overcome those misperceptions and help everyone understand we had a large network, that we had a lot of extra benefits that folks were not aware of. So by doing that, comes how do we create that kind of campaign, that information sharing, and tying that back then to our membership and the growth, the retention numbers, the new memberships, and really diving into that. So through that activity over the past kind of 18 months, we've been able to see a change in those misperceptions to now being aligned with how we want. And we've also experienced that growth in enrollment and that growth in revenue. From an enrollment standpoint, those things are all readily available out there, public numbers. We've seen an increase in our membership by 20+% at this point. And when you go in and start looking at certain factors that we're all familiar with recertification being paused for Medicaid, et cetera, you dive further into the details. We're seeing a change in the open market choice area and an increase in market share there that we haven't seen for the past 8 years. So when you really understand your customer, you can tie it right down to that financial aspect through the membership numbers.
So let me ask you a follow-up, conversation around that. So 20% increase in growth, tremendous number, right? James would agree. Every P&L people would like that. Two topic for you to kind of guide us. Is it mainly from new growth, new acquisition, or you're actually retaining more members that is also impacting because you have that strategy in place from the onboarding, going at it that, hey, look, it's not too late to think about retention when we, start the onboarding. And the second part along with that, how much is it strategy only and how much is technology, or is it a combination that really allows you to be nimble like that in 18 months, you're able to really impact the bottom lines?
Yeah, so I mean, the first part of that around the new acquisition, new membership versus, retaining members, it is a combination of both. And the retaining aspect has many different lenses you can look at it. And what we've actually seen is a growth in membership through folks not needing to recertify, but further down that rabbit hole, we have seen a decrease in the amount of folks leaving our plan in the first 30 days. And part of that is around the onboarding strategies. One of the biggest issues with our Medicaid enrollment the first 30 days was around not feeling their doctor was in the network. And I use that term feeling because we have a very robust network. And sometimes it comes down to a phone call to try to get an appointment where maybe the front office is not aware that they take your plan or they don't have an appointment. And that's a reflection then of the plan. So we really try to set that expectations, like we talked about at the beginning, of look, you might have a challenge. You might not have the right PCP on your card. You might not be able to get a hold of them. We're here to help. And that's where we kind of be that concierge, that Sherpa to guide them during that first 30 days. And then you asked a little bit about, is it a combination of strategy and technology? Absolutely. From a strategy side, it's the flow of that communication. The actions that we're doing need to be understood and heard from every single area and why, but not just inside the plan, also from the doctor's office, the community leader standpoint. Those are the folks that we are serving, that they talk to on a daily basis. That's who matters most in their life. And on a technology side, how do you track it? How do you have it all sitting there so that at your fingertip, you can just hit a button to see what this person's getting, or to be able to really understand the language that you should be able to talk to based on the type of member you're working with.
No, great points. Taking, you said the magic word, doctor. We sometimes call them the providers. There's payers, there's providers, there's pharmacy, there are patients, a lot of P's there. Michael, so you come from a very strong background of technology, being a consultant and all of those good stuff. When you look at providers, right, as a pair, value-based care, you're doing outreach to both members and providers to get the same thing done, whether that's back to James's point, look, how simple, how easy it can be. Set up an appointment, or schedule an appointment, and then actually get the prescription, whether that's mailed or, pick up, refill, right? How do you see that part of the world, like leveraging data, leveraging all of those activities, all again centered around, the key we're discussing in the retention, right? Rather than, hey, it's a provider engagement. We don't really care. We care about their gaps in care. There's member engagement. They're all for the same purpose, right? Walk us through, give us some examples, explain your view, how to leverage data to kind of like combine all of those, portion of it.
Yeah, I mean, a very simple kind of example there is, we talked about trust at the beginning, okay? Well, a lot of the time, members trust their doctor before they'll trust their health plan at any point. So, maybe it's a question of, for some people who we know have a low trust factor, maybe we can leverage the provider in that onboarding and give them some information to be able to help that member transition or just understand their benefits a little better. So using the provider as well as that kind of the sharp end to do some of the engagement, where either that you have an issue of abrasion, or even that it's just the best place for that message. Closing a care gap, for instance, if somebody's unsure or maybe worried about getting a particular screening, if we know that on the health plan side, why can't we shoot a quick message to the provider to say, hey, next time they're in, maybe just have a more in-depth conversation with them about this. This is what we recorded. Now maybe have that conversation more fully. I think the same applies, and I know Justin and James mentioned this. It's not just providers either. It's like, the community partners, they're at the sharp end a lot of the time, dealing with things like food insecurity or transportation issues, those kind of health inequalities that we've got. I think it's important that the people that are doing the work at the sharp end have the ability to connect into that health ecosystem, so that data can be shared with the health plan. Then the health plan can take that and come up with a sustained reaction, rather than really just trying to kind of muddy the waters almost in the community. And again, that's something where they've got the trust. The nonprofits and people and community partners, they already have the trust of the community. So leverage the best person within that health ecosystem to do that outreach or that conversation. Again, I think that just, if I'm a member myself, so I often look at things through my own selfish lens, but even for me, yeah. I know when I first moved here, it was a nightmare trying to navigate healthcare. So just somebody being able to intersect with me at that particular point, wherever I was on the journey, that would have been amazing. I still like that now.
No, it's a great point. And there'll be another topic, which healthcare is better, but we're talking about U.S. healthcare today. So James, question for you. So we heard all of these, right? Providers, gotta understand like how to prioritize, and you have a lot of interaction with the healthcare executives, like, and you mentioned that you must find the vendor that can do what the goal is, which is how they interact with the members. And as executives, you don't interact with the members. So how do you, when there's so many different departments, so many different activities, and there's no lack of technology in healthcare? I say that with, a very big passion, because there is. You can go find, like, everybody does everything, right? How do you create, from the health plan perspective, that you have a goal, your platform needs to be able to interact with the members, but what does your provider platform looks like? Like, how do you start normalize this? Or is it really a true problem that you hear day in, day out? Or what kind of solutions do you think in a perfect world could help healthcare?
Yeah, I think that the first and foremost, as I matured in my career, I think people that come in risk adjustment and stars, in the old days, everything's about getting the chart, getting as many charts as possible, getting them submitted. It's a numbers game. If you get all the charts, you can get as many codes as you want. And, you're better off with your auditor, you're better off with RAPS. Then EDPS came along. Now it's really evolved into more of, you have to have talented people that are writing the value-based care platforms and programs with your provider groups. And you really have to have, they can't be siloed. If you have an vendor like Insighten and you have vendors that support you, it's really a group effort. So you have to bring your vendors into the picture with your value-based coordination type of platforms and programs, because everybody is swimming, in the same direction. And we all want to have high star ratings. We want to have good customer experience. We want to have good clinical outcomes. So it all really starts with the value base and the network and the contracting. I've even advised at times, the great thing about Medicare is that you don't have to be the biggest to be the best. Sometimes you can jettison some of your provider groups that don't want to play ball, and get rid of some provider groups that are hurting you clinically and with your membership, and actually get a better star rating and go back and contract with them 2 years later as a 4.5 star on much different terms. So I think that's the first thing. The second thing is, we all have great technologies. Everyone who I consult for and have worked with over the years, great platforms, brilliant people here, people in India, people in the Philippines, people in the Dominican Republic. It's a very global, talented society. Whatever you could do to use technology to get real-time data. I'm a big concierge guy. I'm a big person on, if I know that John Doe has an appointment with his endocrinologist, if I can help schedule the appointment for him, if I can use Uber or Lyft to take him to the appointment, and then if I can contact him the next day after the appointment to say, hey, how was your experience with, Dr. Smith? I'm getting real-time in-the-loop feedback. And if I have constantly positive feedback, that gives me some nuggets to share when I'm with my joint operating committees or doing my provider education. If I'm getting constantly negative feedback on specific groups and zip codes, then I'm armed with my education to make those things right before the cap cycle, because you only get that information once a year. And by the time those surveys go out, it's too late. By the time the surveys come back, you're halfway into the next year. So you need to use technology for a real-time feedback loop, and then share that information with your providers.
No, that's key. Real time is always a challenge in healthcare. We get it. We know it. Sometimes claims take so many days, or consumers would say, where's my referral? Where's my pre-authorization? Like, from my experience, when I deal with our customers, which, mainly our payers, where, we always hear that, look, we get it. We have a problem with our caps on house. Like, we want to improve the satisfaction. How do you measure satisfaction in real time, right? Well, guess what? It can be done. That's what platforms like Amazon, platforms like Facebook do it. They know what's going to trigger what. They understand their consumers. And they do it because the technology exists. It's collaborating the data, right? We don't have shortage of data in healthcare. There's data everywhere. But if you ask anybody in the healthcare, it's like, how good is your data? They'll give you a smile first.
Well, you
And
know,
then you say, how real? Yeah.
even in other industries, you know, I recently had I had to get some brake work done on my car, and I took my car in to get it fixed, and it was very good. I got a text message from them a couple of days later to say that, how was your experience? Can you rate us on a 1 to 5? I think that there's some complex issues here, but we can simplify with just that constant touch and using and leveraging technology. Older populations, people in their 80s and 90s, aren't going to use that. But a lot of people that are aging into Medicare, they've used that technology for the majority of their adult lives. So you really just have to segment your market appropriately.
Absolutely. And, you know, the great point there is every healthcare organization has call centers for whatever, customer service, you know, care coordinator, it doesn't matter, right? And then their management would look at reporting, would look at like, how is the call? Like, you know, how long did it take to solve a problem? You know, they're so focused on the customer service aspect of it. Now, if you think about it, data comes in, right? When they're having a conversation, somebody might be telling you exactly what you need to know from them without you creating a survey, because the voice tone, the words they're using. So think about it this way. Well, why isn't there natural language processing utilized to really understand the sentiment of that call in real time? I get it. Like, we're all focused on how is the customer service, like how is the member, what are they saying? And if you see some trigger words coming in, guess what? Click it immediately. You know, we talked about our industry, right? Go put a bad review on anybody's social media, whether that's a Ritz Carlton or any of those places, you will get interaction immediately. There is no wait period there. So again, like, technology exists. We just don't tie in the strategy sometimes to really get to the bottom of it, right? So great point. So Justin, back to you on this conversation. So let's bring it all back to our topic, right? You know, we're discussing today, and you know, we had a lot of conversation around topics like improving member onboarding, right? It's never too soon to think about retention. We talked about strategy, we talked about technology, we talked about all of those aspects of it, right? But if you think about communicating with the members, that's coming from typically predominantly your team. You're working with all these other departments to create the communication channel, right? Even the content sometimes. So give us your, you know, wrapping all together from start to end, onboarding to retention being the key, and then leading up to the next onboarding, which would be post AEP, right? Now we have OEP too. So again, those are for Medicare Advantage only, but sometimes Medicaid as well. So wrap us around all of those different topics we had, you know, your view.
Yeah, I mean, kind of twofold to wrap it around, and that's the first being when you talk about onboarding, recertification, retention, engagement, plans kind of needs to think about those as it's all the same thing. The actions that are being done in the engagement world are very similar to the actions that need to be done in the onboarding world. The actions that are happening in onboarding are the same things that need to occur in retention. And that's really because it's all one journey for the member. And for plans to start thinking about this differently, it really helps you take an approach to create a holistic view from the start all the way to the finish. You know, hopefully they renew, but it really is a case where the actions you're doing in the engagement world, whether it might be your creating personas and segment risk stratification of your membership, these are things that can be done on the onboarding, and really jumping in to understand that each onboarding experience can be a little bit different and tailored to the information you know about that person already. It might be that they were auto-assigned or they chose your plan. That's a piece of data that can help inform your content. And then, you know, age, different types of consumers, you can actually communicate differently and then carry that forward throughout their journey. And then secondly, it's really around this bringing it all together, it's, you talked a ton, James and Michael, around, the digital, the platforms and everything around it. And it's from an inside the health plan perspective, you really can't think of it anymore as just a platform. It needs to be more of a value creating platform, a health platform. When you think about things like how people interact, example being they use Facebook, how they search, example Google, how they buy products, Amazon. Well, what is it with that health plan? What do you want them to do? Do you want them to have a greater hand in their health, or do you want them to be able to really just communicate to the health plan? And I think by creating that thought around the digital platform in a different manner, it no longer becomes that linear value, or a plan speaking to a member directly. It needs to be more of a two-sided value. And that's where you can have some success by working all of your partners into this digital platform to be able to create that two-sided value with your member or your provider.
No, great comments and feedback. For the audience purpose, just so you know, we're getting a bunch of questions that are coming through. We are compiling them. Lovely Carissa is helping me to get those questions lined up. So final 10 minutes, we will cater towards the questions. Well, we have a few minutes left. James, talk show host, radio talk shows. This is awesome. I love it. We're used to watching ESPN and all those, right? They go quick, right? So I'm going to put you on spot. 3 takeaways for our audience around, onboarding and, retention. 3 takeaways. Walk us through.
Yeah, I would say the first one we've talked about over and over again. You have to have the proper technology. So you have to have the proper technology to support your staff and strategy. You have to make that investment. You have to have the right vendor, whether you insource and outsource it. I'm with Justin. I'm really big on insourcing processes. I've had a lot of success insourcing, but it depends on the maturity of your plan. If you're at a plan that's really kind of a startup, you're probably going to outsource a lot. You're a plan that's been more established, you're going to have a little bit more revenue to insource. So I think that's the big start. A second one, you got to have leadership. You have to have leadership that really, I think everybody on this panel really understands. I know your team, George, Carissa, they really have an understanding of what it takes to connect with members. So when you have good leadership, it filters down from the top, and it creates a culture that permeates your entire organization. If you have a culture where the objective, once again, is P&L driven. I've worked at places that were P&L driven. I've worked at places that were member driven. You can tell when you walk in the door when that leader of the department is member driven, and it completely changes everything that you would do. It changes your approach, and to me, that's really critical to have the right leadership. And then I think the third thing I mentioned earlier, people really underestimate the value of policies and procedures. It's annoying to write policies and procedures. It's time consuming. Nobody wants to do it. Somebody quits and you have half of it, and then you have the next person has to come in and finish it. It's a pain. But Enam, when you have strong policies that are written up on how you engage with members and how you do cross-functional programs, intra-department programs, the policies are set in stone. And when you onboard your new employees and new leaders that come into the organization, they know what the policies are. So people don't go rogue and have a member send a mailer out. Everybody is sitting. You have really good compliance programs and PMPs that are shared from the VP level to the director level to the management level. Everyone is a part of their onboarding with the company should be familiar with those policies and procedures if they're in a department that touches members. And I think those are three starts to having a successful strategy and culture to engage with members.
Great 3 aspect. Get the right technology, put the right leadership, and allow your policies and procedures to kind of wrap around those things that you have, and creating the prioritization, whether insource or outsource. And I think I really love the part that you mentioned on 2 things here is you have to have the right leadership to drive the technology, right? I'm going to use a line that a very good friend of mine, he was way smarter than I am, always use. He would say, "A fool with a tool is still a fool." Um, so you have to put the right people, right? And then I think the procedure policy is so important in healthcare, right? Because we're in a regulated industry. You can't just do what Facebook does, right? We can't. That's a reality. And then technology could say like, well, it happens in retail. Well, you can't do that here. I have CMS regulations. So like the technology has to be nimble, right? So I think the right leadership is such a key. And, so really like those three takeaways: technology, leadership, and the procedures, right? So we're going to get into our Q&A session. I got a ton of questions. We kind of filtered through to cater all of them. Great question. So Justin, one of the questions coming from the audience is, for onboarding, how do you leverage your community partners? I know you kind of touched that in your topic of discussion. So the question is, how do you leverage and utilize your community partners as part of your onboarding?
Yeah, I mean, community partners can be one of the most critical things. I would say providers are probably the first, but with the community partners, a lot of the way we do that is holding onboarding events at the community centers or at the food pantries or wherever we might be in the community with those relationships to help new members, existing members get the most out of their plan, right? How we teach them to utilize the benefits, get the extra rewards. But we also really look to work with in the community to the existing members we have to help them ensure that they have the right information or resources to tell others. Word of mouth, it's one of the oldest kind of marketing tactics that's out there. It still works, especially with the communities that we're working with and serving, might be in an underprivileged area. You've got to find the right connection point. You could do as many TV ads, commercials, billboards you want, but you will not reach everyone that you need to in your market. So we spend a lot of time doing that into the communities.
So utilizing the events and then really building a member advocacy kind of a group that reaching out to the members that are within the community, within your partners, and leveraging that, it's been successful for you so far.
Correct. And that's, I will add, what is your hook when you're doing that? And this is where I think every health plan is focused on, something changed on the screen there. But I think every health plan is focused on SDOH, right? But really diving into those granular zip code neighborhood data to identify what is the true resources needed and helping them overcome those kind of barriers by providing access to those resources is the first step before you can get into the community to really educate about your plan.
No, great touch base. James, a question for you came in from the audience that as you're hosting conversation, and you mentioned as part of the conversation that you do hear from the members, the consumers, right? What's the overarching theme you hear from them? What is really they look at when they think about healthcare?
Two things come up very frequently. The first thing that comes up all the time is they feel that they have lack of access. So if they feel like they have to go 20 miles to get to a good podiatrist, or they feel like they're in a gatekeeper network, they'd really rather go to another doctor, but they're not able to go to that doctor. So I spend a lot of time on the program when guests call in explaining the concept of how networks are constructed. That some health plans, go with a model that's more of a gatekeeper model, and there are very few doctors that you could choose. And other health plans, they have a much wider array, and that depending on the dynamics in the region, and the players on the health administration side, it can be different. That's the first thing that comes up. The second thing that comes up, you'd be surprised. There's a extreme disconnect between the CEO, C-suite level, and the member. So a lot of them are very critical and say, "Hey, I know who my CEO is. I know who Enam Noor is, and we see him on TV, and he's a handsome guy. But what can he really do for me to help myself and my spouse to be healthier and to have a better experience. And that's why I have as many CEOs and people on the show. It's not just for prominence, it's really to provide them a window of 30 minutes to an hour to actually talk about their strategy and to talk to someone that's driving around on their lunch break, in Chick-fil-A, waiting, because you have an opportunity to speak to that member that you may not get otherwise. So those are the two things that constantly come up. And I think the more events where you have feet on the street, members love when you show up at the local VFW and you show up at their church and you have mobile mammography and you have programs at the mall or Walmart. They love that because they actually feel that executives like us are getting out of the ivory tower and actually coming down to their neighborhoods to help them out. So the plans that really invest in that and really invest in the community, you see the reflection in their CAP scores and engagement.
No, great point there. Like, there's always a theme, a goal from the C-suites. And then when the tactical actual delivery happens, there's a disconnect, right? Like you say, it's whole care, it's member first. I don't feel that way. Why is there a disconnect, right? So I think very valuable point and makes sense. Next question was not for anybody particular. It was just an open question because we've been kind of comparing other industry and whatnot. Maybe Michael, you can, spend next 60 seconds to kind of quickly touch base on this, that, what do you leverage from the other industry, whether that's retail or anything else that could be resonating as part of the retention into the healthcare, side of it? Because, we don't really always have a shopping cart, right? So what do you do that? So.
Yeah, I think you touched on that earlier on, actually. I think there's a lot that can be learned in terms of that instant feedback and experience. There's a lot that can be learned from retail for sure. And I think trying to uncover that and understand what's happening at the point of service, if you like, is really important. So I think there's a lot there that can be learned from retail, and even things like air travel is another one where there's been great improvements. I know that, for instance, that I think it's Delta now that basically tells you where your bag is in the whole system. So I think there's things across other industries where they've been able to uncover almost the workflow behind it and show that transparently to somebody so they understand where they are in the flow and when they can expect an answer or when they can expect that next step. So I think they're two industries that I think are, there's a lot to learn there from those two, just off the top of my head.
No, it's great stuff. So to kind of take everybody's input today around the topic, right, which is it too early to start retention planning? I think the takeaway is no, you must think about retention immediately, and in some cases it could be even before onboarding. When you think about onboarding, you need to start leveraging everything that is around your community, whether that's community partners you have, whether it's the members, reach out to them. Don't just, say good, pretty things to retain your members, connect the dots. So if the leadership of your health plan is talking about something, have a way, that conversation that leads up, whether that's through the providers that you have, whether that's a value-based care, but make it easy for your members. If you make it easy for your members, and you can make them feel that you understand them, so you're not sending them 50 pieces of direct mail, it's all part of the organic communications. You're going to start building trust, and that's eventually going to impact your retention. So that's kind of my takeaway from all you experts that walked us through, which is very valuable. And I can't thank you enough, Justin, James, and Michael, for our audience today to walk us through this process. And I believe if there's still any more questions, we're more than happy to answer. The discussion is part of this, recording. So again, thank you, audience, joining our conversation today. Hopefully this was helpful. And we're able to answer most of the question. If not, you know how to reach out and we can answer more questions. So again, Justin, James, Michael, thank you very much.
Thank you, Ian.
Thanks, Ian.